Okay, so today I'm going to talk about Hashimoto's and miscarriage. And I don't do as much fertility work as I used to. In fact, I only do it kind of like if it happens to come in here as part of a fibromyalgia case or a Hashimoto's case or something like that, and the person's young and they're been to a fertility clinic, and I start looking at their case, and Hashimoto's is frequently involved with miscarriages, infertility as well as miscarriages. So they kind of go together. So, and it's interesting because in the last year or two, who knows, maybe 3, I'm starting to see more and more doctors run thyroid panels on women who are unable to have children, and then in the histories I find out that the person had started to take thyroid hormone and suddenly they were able to have a child. So yes, so I mean the thyroid in and of itself, so most of Hashimoto's is hypothyroid. There's a small percentage that are hyperthyroid and Hashimoto's thin type patients. But the vast majority who have Hashimoto's have hypothyroidism, along with an immune attack against their thyroid, and hypothyroidism just slows everything down. There's no other better way to put it. It just slows everything down. It slows down the ability of your stomach to work properly. It slows down the ability. It's the second most common cause of gallbladders coming out because it slows down the gallbladder function. It slows down pancreas function. It's a big cause of constipation because it slows down your bowels moving. It also slows down the production of hormones. And then it's kind of an interesting thing. You start getting hormonal imbalances because everything starts slowing down. When you start putting on weight, there are significant changes in estrogen balances. One of the reasons is when you start putting on weight, those fat cells, what they call aromatize your testosterone into estrogen, which for women isn't the most horrible thing until you have too much estrogen, and then too much estrogen starts shutting things down as far as your cells being able to use estrogen, like your ovaries. And then that starts to create an imbalance between your testosterone and your estrogen. The estrogen starts going up, the balance starts going like this. And when you get that, that's when you start having abnormalities with your cycles, because it's not supposed to be like that. It's supposed to be estrogen like this, testosterone is supposed to be lower. Okay, and that comes from just straight hypothyroidism, which I almost never see, but straight hypothyroidism. But hypothyroidism is a part of Hashimoto's. The other part of it is that Hashimoto's is an autoimmune problem, and it appears to have a direct relationship to a lot of other autoimmune problems. It has a direct relationship to autoimmune gastritis, celiac, cerebellar problems where you get balance and sometimes can't even walk, things of that nature, autoimmune hepatitis, and it seems to have a significant relationship to polycystic ovarian syndrome for the same reasons I just got done talking about. But in polycystic ovarian syndrome, as people start putting on weight, and as people start getting imbalances in their BMI, their body mass index, their blood sugar will generally start to go up. They'll start to get more insulin spikes, and this insulin raises their blood sugar. They'll start getting more inflammation, and that raises cortisol, and then that raises their blood sugar, and so that person starts to get insulin resistance. Now, I think it's more relative to the hypothyroid aspect of Hashimoto's that we just talked about, but that person starts to get insulin resistance, prediabetes, metabolic syndrome, and that is what also causes your testosterone to go up, and that is more related to enzymes in the ovaries that just start not working right. And instead of making more estrogen, you start making more testosterone, and you can make both too much. Okay, but then that interferes with your cycle, and it interferes with, and then eventually that interferes with progesterone, which causes you to carry to term. So it interferes with being able to get pregnant, and it interferes with when the progesterone starts getting out of shape. It interferes with the ability to carry to term. So I think probably more directly, just thyroid is really connected heavily to it. I'm not quite sure that the immune connection is the issue, other than that if you get rheumatoid arthritis, there's a good chance that you're going to get Hashimoto's. If you know, there's a lot of connections with autoimmunity around the body. But the bottom line is if you have other issues and then you get Hashimoto's, you're going to go into hypothyroidism. You're going to create the blood sugar abnormalities. You're going to create the slowness of metabolism. You're going to create the insulin resistance, and then that contributes heavily to causing the imbalance in your estrogen, testosterone, progesterone balance, particularly your testosterone going up. And then I've seen people with this chemical makeup who've had 3 children and never have had a miscarriage. But 50% of the time, they're estimating that this particular mechanism is responsible for as much as 50% of infertility in this country. So I think the overall answer is yes, but I wanted to delve into the more specifics as to why that was the case.